We're now just waiting for Dr. Ousseynou.
Yes, I'm here.
Okay, terrific. Thank you. I think we can start now.
Hello, I'm Dr. Fiona Hewe, and welcome to the WHO Africa Media Briefing. And in today's media briefing, we focus on ramping up preparedness for the COVID-19 vaccine rollouts in Africa. We do have French and English interpretation. Please look at the bottom of your Zoom page. There's a globe, and click on the globe and choose the language of preference. Then remember, you can also use the Q&A function to ask your questions. Tell us your name and your media outlets, and also let us know if you'd want to go live. We'll give you that opportunity. Ramping up preparedness. Joining us from Brazzaville, the Republic of Congo, is Dr. Richard Mihigo, the coordinator for immunization and vaccine language government program at the World Health Organization. Then remember, you can also use the Q&A function. And from Dakar, Senegal, all the way tell us your name and your media outlets. The director, let us know if you'd want to go live. We'll give you that opportunity. Ramping up preparedness. Joining us from Brazzaville, the Republic of Congo, is Dr. Richard Mihigo, the coordinator for an update on country readiness, language preparedness program at the COVID-19. Then remember, you can also use the Q&A function. And from Dakar, Senegal, all the way tell us your
Thank you very much,
the director, let us know if you
I would like to take this opportunity to welcome
joining us from Brazzaville, the Republic of Congo, is Dr. Richard Mihigo, the coordinator for an update on country readiness, language preparedness program at the COVID-19. Then remember, you can also use the Q&A function. And from Dakar, Senegal, all the way tell us your
Thank you very much,
the director, let us know if you
I would like to take this opportunity to welcome
as
we are approaching the end of the year of the festive season. Has been really outstanding
and remember, you can also use the Q&A function from Dakar, Senegal, all the way tell us your
Thank you very much. Now,
the director, let us know if you
I would like to take this opportunity to welcome as we are approaching the end of the year of the festive season. Has been really outstanding and the last week alone we have recorded more than 5 visits in terms of cases. Thank you very much. Now, 2007, I would like to take this opportunity to welcome. So this is as we are approaching the end of the year of the festive season. Has been really outstanding cases and around 7% in the increase of from the last week alone we have recorded. So the challenges that most countries face for the moment is mainly the decrease in the adherence of preventive measures like wearing masks, adhering to physical distancing measure around. We know very well also that there is a suboptimal contact tracing in many countries, and the management mainly of increase of so the same challenges that we face at the beginning of the pandemic in the adherence of preventive measures like wearing masks, fatigue, adhering to physical distancing, particularly when we are measuring this around we know very well also that there is a suboptimal contact tracing in many countries, and the management mainly of increase of. So, as you have all learned, we have had a major development in the last year vaccines against COVID-19 with the release of efficacy data of several vaccines during the last couple of days. Some countries in the global north, and particularly in the UK, and particularly when we are measuring around vaccination of their population. Today we will discuss a bit the preparedness and readiness level. So, as you know, the COVAX facility, which is co-led by Gavi, the Coalition for Epidemic Preparedness and Innovation, and WHO, has been established to distribute initially 2 billion physical and vaccine doses equitably across 189 economies across the world by the end of 2021. So the rollout of vaccine across using the COVAX facility, which is co-led by plan to occur in different tranches. Coalition for Epidemic Preparedness and the supply constraint, and WHO are going to discuss that largely today. Established to distribute initially covering 3% of 2 billion UK vaccine doses, with additional tranches across 100 gap as vaccine become available, up to 20% by the end of next year. So we have started working with African countries at WHO, but also with different other partners and to prepare not only for regulatory approvals of these vaccines, as well as defining what could be the delivery strategies as vaccine become available, infrastructure, determining what will be the priority groups who could benefit from the vaccine at the beginning, as well as looking at the financing, advocacy for global equitable distribution of some of these vaccine supply. We know very well that globally and supply is prepare not only for regulatory approvals for Africa in particular and African countries, it will be as well as defining what could be the delivery strategies as vaccine needed infrastructure to make sure determining what will be the priority groups country in Africa not going to benefit from the vaccine at the beginning, as well as looking at a vaccine introduction readiness assessment tool was developed distribution by WHO, UNICEF, and other partners, and deployed in very well globally, and so far the average regulatory for the region is around in particular 5%, which is not as well as where we like to introduce a new vaccine or to conduct an efficient vaccination drive. So this is definitely below, as well as looking at vaccines for an urgent introduction, readiness, and we are going to hear from our colleague from Senegal, the director for EPI program in Senegal, what country are going to do in that not as well as where we like
Thank you very much,
a new vaccine
Djigo.
or to conduct an efficient vaccination
Dr.
drive.
Badiane, we've heard that
So this is
countries
definitely
are
below
preparing
as well
and running our eyes through the
so
preparedness.
for
We
an
see that
urgent
Senegal has really done an excellent job so far compared to many other countries.
production,
So could you tell us how
we are going to
Senegal is
hear
preparing for the rollout of the COVID-19 vaccines?
Merci beaucoup, Fiona. Donc, bonjour à tout le monde. Bonjour à Richard.
et an efficient
Bonjour aux
vaccination
autres
Dr.
collègues connectés. Donc, pour cette occasion, de
we've
nous donner
heard that
So this is
countries
definitely
are
below as
preparing
well as
Sénégal par rapport à l'introduction de ce nouveau vaccin. Donc, je rappelle que le Sénégal fait partie de la coalition donc AMC, donc l'initiative COVAX, et fait partie des pays qui ont été sélectionnés aussi pour pouvoir introduire ce nouveau vaccin-là. Et comme l'a dit Richard, donc il y a un outil de préparation qui a été développé par l'OMS, le DIRAC, donc on a utilisé pour évaluer un peu l'état de préparation du Sénégal. Et on voit qu'on est au-dessus de la moyenne de la coalition donc AMC. Donc ce qui concerne le Sénégal, sur les 10 composantes, on est à 61% des pays qui ont été sélectionnés aussi pour pouvoir être 37% pour sélection au vaccin. Et comme l'a dit Richard, il y a un outil de préparation qui a été développé par l'OMS, le DIRAC, donc ce qui veut dire utiliser pour évaluer un peu l'état de préparation du Sénégal. Par rapport au Sénégal, on est dans ce qui a été au-dessus de la moyenne de la coalition donc AMC. Donc ce qui concerne le Sénégal, sur les 10 composantes, on est à 61% des pays qui ont été sélectionnés aussi pour pouvoir être de la santé et de l'efficience au vaccin. Et comme l'a dit Richard, il y a un outil de préparation qui a été développé par le DIRAC, ce qui veut utiliser pour évaluer un peu l'état de préparation. Par rapport au Sénégal, on est dans ce qui a été au-dessus de la moyenne de la coalition donc AMC. Ce qui concerne le Sénégal, sur les 10 composantes, on est à 61% des pays qui ont été sélectionnés aussi pour pouvoir être de la santé et de l'efficience au vaccin. Et comme l'a dit Richard, c'est un outil de préparation qui a été développé par le DIRAC, ce qui veut utiliser pour évaluer un peu l'état de préparation. Par rapport au Sénégal, on est dans ce qui a été au-dessus de la moyenne de la coalition donc AMC. Ce qui concerne le Sénégal, sur la composante.
Merci beaucoup, Dr. Badiane. Now that we've had from our panelists, it's your turn to ask questions. And remember that to do this, you can use the question and answer function that is at the bottom of your Zoom application. And please remember that we need to provide the name and the organization that you represent. And let us know if you'd also like to go live. As we wait for your questions, I'll start with the questions that we have so far from the Washington Post, from Danielle Paquette. And please, Danielle, let us know if you'd want to go live.
Absolutely. So thank you so much for taking my question. I am
and let us know if you'd also like
as we
to go
hear things like people are concerned that other countries could receive the doses last. How are officials across the continent responding to those worries?
From the Washington Post, from Danielle Paquette, and please, Danielle, let us know if you want to give that to you.
Yeah, thank you very much, Dr. Tuhebwe, and thanks, Mrs. Paquette, for this question. The issue you raise is it's a true concern for many people, not only we at WHO, but also many countries have expressed that concern. As we have seen the acceleration of approval of the different products, but also the beginning of the rollout or very clear timelines for several countries in the global north of the rollout of the vaccine. It has become quite evident that the distribution, the equitable distribution of the vaccine, that concern, particularly in low income or low middle income country, is a real problem. As we have seen, this has also been compounded by the fact that we are seeing now many countries have even pre-ordered vaccine doses that are by far rollout of the vaccine greater than what they need for their own countries. So it's really raised the issue evident that vaccine, as we have been saying since the beginning of the WHO, nationalism, and the imperative by the moral imperative of distributing. We are seeing now many countries across all the country pre-ordered vaccines that are by far. Having said that, greater than what they need. We have tried through not only the COVID, really raised the issue some very interesting initiatives that has been led by the African Union to see how and African imperative by the moral imperative of distributing. We are seeing now many countries across under all the country pre-ordered African Union. So that by far, having said how we have tried through more only the COVID, really raised the issue some very interesting initiatives that has been led by the African Union as well. To see how and African imperative by the moral imperative of distributing. Not when many countries across under all the country pre-ordered African Union. It is quite important. Having said how we are not only tried through more not only the COVID, really raised the issue some very also interesting initiatives that has been led by the African Union as well. So become quite crucial. African imperative by the moral imperative of vaccine in Africa. Not when we are across all the countries pre-ordered African Union. It is quite important. Having said how we are not only tried through more only the COVID, really raised the issue some very also interesting initiatives that has been led by the African Union as well. So become quite crucial. African imperative by the moral imperative of vaccine in Africa. Not when we are
Daniela, you have the floor. Kindly unmute your microphone.
Ordered African. It is important.
Can you hear me now?
Yes, we can.
All right. Yes. So I'm from the Punch newspaper here in Nigeria. I'm just calling with regards the amount of money that Africa needs if it's going to meet its the supply of vaccines. How much worth of vaccines will Africa actually need to tackle the COVID-19 pandemic in the immediate term and in the long run? How much do you think Africa is going to require? Thank you. That's my question.
Thank you very much. Over to you, Dr. Nick.
With regards the amount of money that Africa needs, if it's going to meet its the supply of vaccines, how much worth of vaccines will Africa actually need to tackle the COVID-19 pandemic?
To reach at least 20%. But as I said before, there are a lot of discussion now going on. If we really need to reach a herd immunity that will help really people to go back to some sort of their normal life, we will definitely need to vaccinate.
What vaccines will Africa actually need
of the African population? So if you consider that we have around 1.2, 1.3 billion people on the African continent, and you take 60% of that, with the assumption if we really need to reach maybe 2 doses per population herd immunity, we are talking about close to 1.3, 1.4 billion. If you consider that we have around 1.2 to immunize 60% of people in Africa, 3 billion people on the African herd immunity. So if we compute that number with the preliminary information that we are getting with these vaccine manufacturers, including, because it's not only the cost of the vaccine, there are also we are talking about that are needed to deliver those people in Africa, 3 billion people. We know very well that the preliminary, so if we compute that number, we may need to preliminary information that we are getting. So this is a lot of funding, a lot of money that will be needed, including first of all, we are not sure that we are going to get. There are also we are talking about that are needed to deliver those people in Africa, 3 billion people. We know very well that the preliminary. So if we compute that number, we may need also to mobilize preliminary amount of money we are getting. So this is a lot of money. To be another additional challenge. So it's foreseeing that funding may come. A lot of money different, including one of them being the COVAX facility. So it's not only the cost that we are going to get. There are also at least we're talking about that are needed to deliver. There are currently discussions going on billion people. We know very well that they can use the preliminary. So if we compute that number, we may need also to mobilize preliminary amount of money we are getting. So this is a lot of money. To be another additional challenge. So it's foreseeing that we have still have a long way to go to make sure that, including really mobilize. One of them being the COVAX facility. This is not only the cost that we are going to get. There are also at least we're talking about that are needed to deliver. There are currently discussions going on billion people. We know very well that they can use the preliminary. So if we compute that number, we may need also to mobilize preliminary amount of money we are getting. So this is a lot of money. To be another additional challenge. So it's foreseeing that we have still have a long way to go to make sure that, including really mobilize. One of them being the COVAX facility. This is not only the cost that we are going to get. There are also at least we're talking about that are needed to deliver. There are currently discussions going on billion people. We know very well that they can use the preliminary. So if we compute that number, we may need also to mobilize preliminary amount of money. So this is a lot of money. To be another only one. So that's foreseeing that we have still have a long way. We are clearly seeing that, including mobilize. One of them being the what we discussed at the beginning. This is not only the cost that we are going to get. We're talking about that there are currently discussions going on billion people. We know very well that they can use the preliminary. So if we compute that number, we may need also to mobilize preliminary amount of money. So this is a lot of money. Only one. So that's foreseeing that we have still have a long way. We are clearly seeing that, including mobilize. One of them being the what we discussed at the beginning. This is not only the cost that we are going to get. Beyond this, we're talking about that there are currently discussions going on billion people. We know very well that they can use the preliminary. So if we compute that number, we may need also to mobilize preliminary amount of money. So this is a lot of money. The level of prepare only one. So that's foreseeing that we have still have a long way. We are clearly seeing that, including regulatory. One of them being the what we discussed at the beginning. This is all we are only the social polarization. Beyond talking about vaccines, there are some discussions going on really. We know very well that those are, so if we conclude that we may need also to mobilize the pandemic. So this is a long issue. The level of prepare only one of there. We have until the long period. We are clearly seeing including regulatory, one of them being what we discussed at the beginning. This is all we are only the social polarization. Talking about vaccines, there are some discussions going on really. We know very well that those are, so if we conclude that we may need also to mobilize the pandemic. So this is a long issue. The level of prepare only one of there. We are seeing that we have until the long period. We are clearly seeing including regulatory, one of them being what we discussed at the beginning. This is all we are only the social polarization. Talking about vaccines, there are some discussions going on really. We know very well that those are, so if we conclude that we may need also to mobilize the pandemic. So this is a long issue. The level of prepare only one of there. We are seeing that we have until the long period. We are clearly seeing including regulatory, one of them being what we discussed at the beginning. This is all we are only the social polarization. Talking about vaccines, there are some discussions going on really. We know very well that those are, so if we conclude that we may need also to mobilize the pandemic. So this is a long issue. The level of prepare only one.
Il y a le problème de la communication et de la mobilisation sociale. Donc, le vaccin a déjà circulé. Donc, actuellement, il y a une discussion qui montre au créneau.
Know very well that
il n'est pas encore arrivé. Donc, même le vaccin
we may need also
en train de jeter même les discrédits sur les
vaccins
qui ne sont pas sûrs, on ne connaît pas les effets à long terme. Et beaucoup de personnes disent même qu'ils ne veulent pas se faire vacciner. Donc, défi de communication. Moi, je pense que les deux n'est pas un vaccin qui peut s'aligner. Même le vaccin d'approvisionnement. Ils sont en train de jeter même des défis qui va être demeuré quel que soit le vaccin qui va être communication et la gestion des livres. Au revoir.
Thank you very much, Dr. Badiane. The usual issues that we see, but now with this COVID vaccine, it's a special one. So we do have questions coming from Naftali Mwaura from Shinwa, based in Kenya. And we have the first one. How do you rate Africa's Dr. Badiane, the usual the second one will go to Dr. Badiane. We have robust infrastructure. So we do have questions coming from Naftali Mwaura from Shinwa, based in Kenya. And context. We have the first one. How do you rate Africa's the second one will go to Dr. Badiane. We have robust infrastructure. So we do have questions coming from Naftali Mwaura, Africa's preparedness in Kenya. And third one will have it. We have the first one. How do you rate Africa's Dr. Badiane. The second one.
We
have robust infrastructure.
Before maybe responding to this question, the first question, I would like to stress the fact here that indeed
we have the first one. How about Africa's
one of the
second one, Dr. Badiane. We have robust infrastructure.
Before maybe responding to this question, the first question, I would like to have quite a robust experience in conducting mass vaccination campaign, usually targeting under 5 years old children, or to some extent like campaign for meningitis vaccines or yellow fever, going even beyond adult population. So there is a minimum of and quite very good experience in many countries in conducting this mass vaccination campaign. But going back specifically for this COVID-19 vaccination drive, I think with the vaccine introduction readiness assessment tool that has been deployed in all the country, and the information that we are starting to get, clearly we are at a level where, as I said in my introductory remarks, which is not satisfactory, around 35%, 40% overall. But we know very well that in many countries, they tend to ramp up these type of activities when we are getting close to the vaccinations period. And I believe that many countries, with the support of not only WHO, UNICEF, but other partners, are going to do what it will take to really make sure that the preparedness is at a level where it's acceptable. Definitely, as Dr. Badiane said, there are many unknowns in terms of the product that are going to be coming in and etc. But I think most of the country are dealing with these sort of gray areas in moving forward with their preparation. So we are quite confident that with the required technical support, with the required guidance that we are providing to the countries, building on the past experience, we are going to get to a level where once the vaccine are going to be available, country we will be definitely ready. Now, with regards to the costs, again, this is an issue, as I mentioned in my previous answer, that many unknown are still there. Because out of the current available vaccines, we know very well that they are coming with a completely different cost. It will be quite challenging for the moment to put a price tag on some of these things. But we have done some estimation, we've done some calculation to see how it will take. And for the moment, working with countries to not only define, and it's important to mention that it's not only the cost of the vaccines themselves. It's also we need to factor in as well the cost of delivering those vaccines, because it will be such a shame if we can have the vaccine stored in our national cold rooms in capital cities, and this vaccine cannot get to the people in the remote peripheral area that needs them more. So this is currently an exercise that is being done country by country to try to cost not only the vaccine, but also the delivery strategies that are going to be used. And I believe as time pass and the information become available for the different product, we are going to refine these numbers to make sure that country can do the right advocacy and resource mobilization with proper figures.
Thank you very much, Dr. Mihigo. So Dr. Badiane, over to you. Do we have enough infrastructure and manpower to roll out this vaccine?
Merci, Fiona. Donc, je pense que, comme l'a dit Richard, je pense que le Sénégal a une très grande expérience dans l'introduction des nouveaux vaccins et dans l'organisation des campagnes de vaccination de masse. Je rappelle qu'entre 2013 et 2018, le Sénégal a introduit 7 nouveaux vaccins, ce qui fait un vaccin presque chaque année. Donc, je pense que ça, c'est quand même une grande expérience et que le système de vaccination du Sénégal aussi est assez robuste et assez performant pour le moment. Donc, mais en fait, ce qui fait qu'on ne peut pas encore se prononcer, c'est qu'on ne sait pas quel vaccin introduire. Parce qu'en réalité, si c'est un vaccin qui, comme je l'ai dit, qui peut être intégré facilement dans le système de routine qu'on peut conserver comme les autres vaccins du PEP, ça, ce n'est pas un problème. Parce qu'en fait, en termes de capacité de chaîne de froid et de disponibilité, je pense qu'on a quand même une bonne disponibilité de chaîne de froid pour conserver un vaccin entre 2 et 8 degrés. Mais si, par exemple, le vaccin qu'on va introduire est un vaccin qu'on doit congeler, je pense qu'il y a tout un système encore à mettre en place. Donc, si c'est ça, il y a un système à refaire. Et ça va demander quand même beaucoup de moyens, même si on sait qu'il y a quand même des soutiens qui sont en vie pour pouvoir relever ces défis-là. L'autre chose, par rapport aux coûts, donc les coûts aussi, il y a beaucoup d'incertitudes, il y a des choses il y a beaucoup de paramètres qu'on ne maîtrise pas. Donc ça va dépendre des vaccins, combien le vaccin va coûter, mais ça, c'est juste pour l'approvisionnement, mais il y a les coûts opérationnels. Les coûts opérationnels vont dépendre aussi du type de vaccin, comment on va conserver les vaccins, comment on va les déployer, mais aussi de la cible, qui on va vacciner, combien de pourcentage de la population on va vacciner, et des modes d'administration. Est-ce qu'on va faire une campagne de masse ou bien on va l'introduire comme un nouveau vaccin dans le cadre de routine. Donc, tout ça fait qu'actuellement, il est très difficile d'estimer les coûts, mais je pense qu'il y a des mécanismes qui sont mis en place pour pouvoir supporter ces coûts-là pour introduire ce vaccin avec succès dans le pays. À vous.
In fact, indeed, very many unknowns that we are looking at with the COVID-19 vaccine. Dr. Christopher Kadisa from Uganda, please go ahead with your question. Okay, Dr. Christopher Kalisa has asked, what are the cost implications of the COVID-19 vaccine rollout among East African states with low economy post-lockdown? I will give this to you, Dr. Mihigo.
No, thank you very much, Dr. Tuebwe, for this question. One of the guiding principles when the COVAX facility was established was really to make sure that low-income countries or low and lower middle-income countries can get vaccines at an affordable cost without putting their own economy at risk. We know very well that the different lockdowns have heavily affected the livelihood, but also the economies in many countries. And definitely, this has been one of the major factors that has driven the WHO, but also others to push for a global solidarity around that. So countries that are going to get access of vaccine through the COVAX facility are going to get that vaccine at a subsidized price. So most of them are not going to pay anything. So because resources has been raised to make sure that those countries can get access to the vaccine. But as we said before, there will be a need also at local level to mobilize additional resources to make sure that the vaccination drive itself can be conducted efficiently. We heard from our colleague from Senegal that we need absolutely to make sure that there is a proper distribution channel and etc. So all of these things are currently being factored. Some of resources will, at least for the low-income country, as part of the AMC Advanced Market Commitment 92 group of countries, some of these resources will come through Gavi. But they've been quite a very interesting and generous initiative by the World Bank to also support countries, low-income countries, to see how they can also, the World Bank can contribute to the meeting some of these costs at country level. And finally, I believe that we have seen as country finalizing the development of their national deployment and vaccination plan. Country are also exploring some local opportunities some local resources that could be raised, either using national resources, but also some private public partnership that could be leveraged at country level to support this effort. So many strategy being looked at country to make sure that everything is going to be in place to start vaccination as soon as possible. Thank you.
Thank you, Dr. Mihigo. Dr. Badiane, we know that Senegal was also as affected as many other African countries with the lockdowns, and the economy has also been affected. Countries are being requested to do to fund the operational costs. How prepared or resource mobilization wise do you think has Senegal gone?
Merci Fiona. Comme vous le direz, donc tous les pays sont impactés, donc le Sénégal aussi.
Thank you so much, Fiona. As you said, all the countries are impacted. Senegal was no exception. For the vaccines, I believe Gavi will give her the support. We can mobilize 20% of the cost, but we also need the funding of the institutions. We also need to understand the funding mechanism. We have three possibilities. The first is that the government may decide to take charge of the cost. And after that, we have other two possibilities. The first is the World Bank to fund the institutions, or PPP, that they can raise funds to support the institutions such as Gavi. We already have an experience when we were talking about hepatitis B vaccine. We had that experience. And I believe this time around is not going to be an exception. Therefore, these are the three scenarios. Either the government finances it, or funded by the World Bank, or we will raise local partners through a PPP to fund the vaccine distribution. Thank you so much, Fiona.
Okay, thank you very much, Dr. Badiane. Souleymane Djigo, vous avez la parole. Veuillez poser votre question, s'il vous plaît.
Bonjour, bonjour à tous. Alors,
good morning to you all. I'm a journalist of Skype 2 and also journalist for a British scientific journal. My concern has to do with access to the vaccine. We are saying that Africa is getting ready or is already ready to get a vaccine, but we do not know the kind of vaccine it's going to be. Dr. Badiane has stated that clearly. My question is, Africa, are we not a bit late in terms of negotiations? Negotiations in terms of the use of the vaccine and what kind of vaccine? I think, as you know, in many countries across the world, they already know what kind of vaccine they are opting for. Morocco has already chosen the Chinese vaccine and has already made firm communication on that. Therefore, my concern is, are we not late regarding the choice of vaccine? Thank you so much, Fiona.
Okay, Dr. Mihigo.
Oui, merci, Monsieur Souleymane, pour votre question.
Thank you, Mr. Souleymane, for your question. I think you are right. We have not been able to give any clarification on the matter. We already know the kind of product that we have that are under negotiation. we have signed a good number of agreements in terms of the vaccine. I can give you, for instance, that we have firm agreement that we have reached with AstraZeneca, the use of their vaccine, and also that of Oxford University. We have already also concluded agreement with COVAX facility and Serum Institute of India. And these institutions are committing themselves to produce vaccine for us, and not only for this, but also for future vaccines for the candidate vaccine. There is also a third agreement, which is currently under discussion with the Sanofi and GSK vaccines through the COVAX platform. Therefore, you will see that we have already clear partnership, and some MOUs has been signed between COVAX and then many other vaccines that will be available. But where we want to be very careful is how many dosage that will be available coming from our partners for annual distribution for the continent. You also know that these are companies, they have also signed agreements with many other countries across other regions. And the distribution of those vaccines may not be proportional or may not cut across. Therefore, we have some hopes concerning the vaccines. And most of these vaccines, the candidate vaccine, the AstraZeneca vaccine, for instance, could be very attractive because it is a vaccine that can be stored in the traditional storage facilities that we know, in all the vaccination campaigns that we have already had on the continent. And Dr. Badiane has stated that clearly in his submission. I believe in the next weeks to come, we surely will have data on vaccine candidates. Therefore, we still have some level of openness on the vaccines, although we do not know when they will be available on the market. And we also have negotiations already far in advance. Therefore, allow me to reassure you that indeed we are not late, but it's just a matter of the situation I have already explained, the matter of distribution, which will be a little bit difficult. However, we are doing our best. WHO, Africa Union are all doing their best so that we can have a comprehensive lobby for the continent to have access to the vaccine within the shortest possible time. Thank you, Fiona.
Thank you very much, Dr. Mihigo. As we wind up, we shall have a few questions. Andrew Green from DEVEX, you have the floor to ask your question. Please go ahead, Andrew Green. Or I could read out your question. So, Dr. Mihigo, Andrew Green would like you to comment on South Africa and India's call for a waiver on intellectual property barriers on COVID-19 related products, including vaccines, and whether it is a useful effort for gaining access to vaccines in the low and middle income countries in Africa.
The issue of intellectual property is not new. We've seen that with the at the beginning of HIV pandemic. It has been very much at the center of the discussion when we entered this COVID-19 pandemic, not only in terms of vaccines, but also even for therapeutics, on how intellectual properties can be waived so that manufacturers from from the South can also produce some of these products at a much more competitive and affordable price. So coming back to the vaccines themselves, I think this has been quite a very tough and challenging discussion. But so far, indication has been that we have not reached any agreement on that, and there have been no, let's say, progress in that area in line with waiving the intellectual property. However, what we could say, we are starting to see quite some encouraging trends, and particularly trying to see how technology transfer can be done from some of the bigger manufacturers to the South vaccine manufacturing industry, so that some of these products can be produced at a much more affordable cost. So this is an area that we need to watch quite carefully. I hope that it will really lead to some breakthrough and improve the access of vaccine for low-income countries.
Thanks again, Dr. Mihigo. Elizabeth Merab from Daily Nation, Kenya. I know you have a number of questions, but in the interest of time, I'll request you to ask one or two pertinent, the most burning questions for you.
Thank you, Fiona. So the first question that I'll ask is, we know that Africa has a young population, therefore deploying the vaccine based on priority considering the elderly will be a bit different from what we've seen in the West. Other than health workers, what would be the ideal priority group for Africa? And the second question that I'd like to ask is about the COVAX facility. The Africa CDC has repeatedly insisted on countries using the COVAX facility and negotiating for a vaccine as a bloc, but some countries like Egypt have decided to make individual plans and negotiations. Other than Egypt, which other countries have made individual plans? Thank you.
Yes, over to you, Dr. Mihigo.
Yes, thank you. Thanks for the colleague from our colleague in Kenya. Clearly, as we know, and that has been the position for WHO, the definition of target group in any country should be based on the local data and the evidence that are generated from the epidemiology of the disease in that particular country. WHO has developed several tools, including a value framework and a prioritization matrix that can help country to come up with what could be the most priority target group that could be considered in this process of scarce resources. So it's true that healthcare workers has been a group that has been quite severely affected by the disease. In some countries, we have seen even a proportion up to more than 10% of the people who have been affected among healthcare workers. So it has been considered that that's really it should be one of the among the priority groups, so that we can maintain the integrity of the health system. So that not only people who are coming to get treatment for COVID-19, but also for other diseases can be taken care of by a solid healthcare worker network. So in terms of ideal target population, it's very difficult to come up with a blanket recommendation on that. We have seen the group that has been targeted in the UK could be different with a country based on their demography, based on their epidemiology, and etc. So our position in this has been to help country to come up with using their local data, the evidence that they've collected the last 10 months, which can help them now to target the right group based on the few supply that exists. And then finally, on your question on a country coming on an individual plan, I think we have been quite very cautious about this approach because Africa CDC, African Union have been on the same page like us. I think the more country come together to make discussion and negotiation, the better they can get access to a fair price. It's really as simple as the market rules, the supply and the demand. So if we come together as a group with a much more important buying power, it would be easy to negotiate. So beside what you have described from Egypt and to some extent Morocco, we don't have any information so far for any additional country that have gone that route.
Okay, thank you, Dr. Mehigo. Dr. Badiane, would you want to make a comment if Senegal has started discussions on selection of different target groups, priority target groups for this vaccine?
Merci. Comme je l'ai dit au début, donc le Sénégal a soumis
Senegal
demande de soumission, a demande à Gavi
has already submitted a request to Gavi for the vaccine introduction. And in that request form, we were supposed to be specific on our target group. I think it all depends on the availability and the kind of vaccine that will be used. We started with a threshold of 20%. And of the 20% of the population, we are targeting the vulnerable groups, people at higher risk. And that has been the first priority line that we have drawn. The aged, people above 60 years. The second is people with underlying health issues. And then also health workers. And I must say that the health workers are our #1 priority. These are the 3 target groups that we have. 30% of the population, that is the figure. And then also the 2 priority groups that I have enumerated. This is not a definite portion, but I believe we will start from there. Thank you, Fiona.
Okay, thank you, Dr. Badiane. Now, as we wind up, Imoh Edet, you have the floor to ask your questions.
Thank you very much.
Keep it quick and short.
Indeed, thank you very much. Good afternoon, Dr. Mehigo. This is Imoh Edet from West Africa Democracy Radio in Dakar, Senegal. I'd like to ask 5 questions, but I'm going to just shorten them to 2. First of all, 3 vaccines have been found against COVID-19. In your opinion, which vaccine will be better for Africa if we think about the conditions? Secondly, vaccination has started in a few European countries. Are the African authorities ready to procure them? And is this an emergency precisely for Africa? Those are my questions. Thank you.
Okay, thank you very much, Dr. Badiane. Would you want to give it a short first, and then we can go to Dr. Mehigo?
Merci, Fiona. Donc, merci pour la question. Donc,
thank you so much, Fiona. I thank you, Imoh, for your question. You wanted to know whether the vaccines are adaptable for our climate. It is difficult for me to answer that question because as of now, we do not know which vaccine that we are going to use. There are a lot of candidate vaccines. And Africa certainly will be choosing the one that will be most adaptable to our climate. If you have a vaccine that must be stored at 2 degrees and others -10, you can imagine which one Africa will be choosing. And I believe that will inform the choice of vaccine of the continent. Before we have massive distribution of the same vaccine among the people. I thank you, Fiona.
Merci beaucoup, Dr. Badiane. Dr. Mehigo.
Yes, I think what I would like to say is indeed we have seen the data from the three vaccine that we've mentioned, Mr. Imoh. But I think what we need to consider here, and particularly having a much more longer perspective, at the COVAX facility, we're looking at a much more larger portfolio of vaccine. We're talking about 8 to 10 vaccines that could potentially be considered. So I don't think that we should necessarily focus only on these first 3 vaccines that have been so far showing some data. But we are expecting that more may come along in the next couple of weeks, including vaccine that could potentially have 1 dose regimen versus 2 dose regimen. So all of these different elements are going to one time to enter into play to make sure that what is the best option and the best product for our country to use. Definitely, we need also to consider that any investment, any additional investment that will be done to deploy this vaccine should not be done on the detriment of other vaccination activities in the country. For instance, we still have a lot of other vaccine preventable disease outbreaks that are still claiming lives. So there should be a balance between, of course, addressing the emergency and the urgency of COVID-19, but at the same time looking at others. So my response to that will not be as straightforward. I think we are seeing what is currently available. We're trying to have a much more broader perspective on the vaccine, promising candidate vaccine, which are in the last phase of clinical trial. And I believe with all of that, a rational choice will be made to come up with a product that will help to address some of the needs that country are facing, being it for logistics parts, but also from other consideration. So on your last point, I think, yes, I think it is an emergency to stop this pandemic. Not only to reduce mortality, morbidity, because we need to save lives, but also to provide some opportunity to countries to resume and to reopen their economies. So the sooner we'll vaccinate the population in the African region, I think the better. And this has been the motto in all the country for the moment, with the hope now starting to point out at the end of the tunnel that maybe the better days might be across the road.
And we really indeed hope that better days are coming. So finally, as we wrap up, the last question to you, Dr. Mihigo, we've heard rumors about side effects of the vaccine related to DNA. How true is this, and how have you carried out investigations about any other side effects? This is from Paul Mfite in Kampala.
Well, before maybe addressing that question, it's true that we heard yesterday in the media some of the allergic reaction for some of the people who received the Pfizer vaccine in the UK. But I think we have yet to learn more about this information. But in a general term, vaccine using the messenger RNA platform is a new technology. But we need also to mention that in the process of developing a vaccine from phase 1, phase 2 to phase 3, before the vaccine can be distributed to a much more larger population, there are several steps that are being quite followed up very strictly, looking at the safety of the product, mainly what are the adverse events that are detected during clinical trial. And so far, out of these 3 products that have shown efficacy data, we have seen quite a very reassuring safety profile for this product. And I think we need to make it quite very clear. Now, going back to the vaccine using the messenger RNA, this is a new technology. This is a novel approach to developing vaccine. It's taking part of genetic material of the virus that will induce the production of a protein in the organism, and then the organism will develop antibody against that same protein. So it's a quite a clever way of prompting the human immunity response to that product and to that host agent. And so far, I think if we looked at the data that has been published for the phase 3, I think we have quite some reassuring safety profile. But we need to be indeed very vigilant and careful to set up a much more stronger pharmacovigilance system that is going to make sure that any adverse events that may have not been noticed during a clinical trial can be easily picked up during the what we call phase 4 of pharmacovigilance system. And we have started to support countries, all the countries in the region, to strengthen their AFI monitoring system, AFI being adverse event following immunization system, their pharmacovigilance system, so that any adverse events being mild can be picked up quite very quickly.
Thank you very much for that explanation, Dr. Djigo. We are coming to the end of this virtual press conference, and we turn back to our panelists, Dr. Badiane and Dr. Djigo. Thanks again for all that you have told us, and to the journalists that were present, thank you very much for your questions. But I would like Dr. Badiane and Dr. Djigo to give us their parting shot, their final words to reassure us about this vaccination, upcoming vaccination. Dr. Badiane, vous avez la parole.
Merci, Fiona. Donc,
thank you so much, Fiona.
C'était vraiment une occasion de partager.
It was indeed an opportunity for me to share my experience and the preparedness of Senegal regarding the vaccine distribution. I can say we have the experience, and generally speaking, Senegal has already introduced a good number of vaccines. And as you know, a lot of precautionary measures must be taken before we introduce any vaccine. Therefore, Senegal is ready. And currently, as we speak, we have all the criteria needed to introduce the vaccine. And I believe many African countries are waiting patiently for the vaccine, and I believe Senegal is also waiting to get its own stock, so that together we can eradicate this monster of virus that is ravaging the entire world. And we must also ensure that communication is key. We need to sensitize our people that the vaccine is for the good of us, the vaccine is efficient, and it is expected that the targeted outcome will be reached.
Thank you very much.
Thank you so much.
Thank you very much, Dr. Badiane. Dr. Djigo, over to you for your parting shot.
Yeah, thank you very much, Dr. Fiona. And I would like to take really this opportunity to thank the media for helping us to continue to update the general public. I have just 3 short messages very quickly. The first one, as I said in my introductory remark, we are starting to see really an uptick in terms of number of cases in the region. This is not the time to relax the measure that has been so far implemented, and that has been really showing some effectiveness in bringing down the number of cases and the burden of the disease in the continent. So we'd like really here to urge the population to continue to stick to the preventive measure that have so far help us really to maintain the number of cases as low as possible. Secondly, we discussed a lot about the access to the vaccines and the risk for some of our countries in the African region to lag behind here. This is probably a time to also make a very strong appeal, not only to our member states, but also to the global community for to make sure that using a facility or a platform like the COVAX facility, but other platforms as I've described before, we can do a strong advocacy for access. And I will even insist on equitable access of vaccine to the African population. And my last message, it's really, and I think Dr. Badiane mentioned it very, very well, it's for towards our member states. As we are all struggling and hopefully are going to get vaccine quite soon, we need equally to be well prepared at country level to make sure that once the vaccine become available, country will be ready to not only receive them, but to roll out them immediately to those who need them the most. So it's imperative that we start now to do all the preparation for vaccine deployment and introduction, and not wait until when the vaccine will become available for us to start thinking about that. So thank you very much. It has been really a pleasure to share this moment with the media.
Again, thank you very much, our panelists, and to our journalists that joined us. We hope to see you next time as we continue to bring you more information. You will either make us or break us when it comes to COVID-19 vaccine introduction, so we count on you. See you next time.